Let me begin by telling you that the title of the presentation was Sudden Cardiac Death in Young Athletes and Pilots and Other Professionals. Now, this is not like one, two, or few cases around the world. You see the media being filled with these cases from countries which are worldwide, and they are still trying to solve the enigma of why young athletes are getting subjected to the sudden cardiac arrest, why young pilots, young professionals, young runners are suffering cardiac arrest. You can see the leading cause of it, which says thrombosis, and I would not like to use the word microclots and clots, please just pardon me for that, because I consider clots are normal phenomena, and only abnormal clots are designated by the term of thrombus or the process thrombosis. So the million-dollar question, that what's the mechanism behind those sudden cardiac deaths? Now we'll go into detail as the slides progress, but here you can see that there is a lining of a blood vessel where so if a person gets infected with SARS-CoV-2 or its spike protein is in the blood in a free state, what happens is that spike protein can attack the endothelium and cause endothelial injury. When this injury actually begins, the sequence of events that follow are interesting in that it's just like normal coagulation or normal clotting, but since the person is not bleeding, and it's happening in as an abnormal phenomena, we call it the process of thrombosis. What happens is that at the site of inflammation, neutrophil comes, it releases some elastases, which is one of its very well-known enzyme. That elastase acts on spike protein, generates this blue structure that you can see. We call it amyloid-like fibrils. And these amyloid fibrils, further complicate the formation of the thrombus, which eventually occludes the blood vessel. So the question is that if a blood vessel like of the heart, which we call coronary artery, gets occluded, what would be the consequence? Now, the blood flow reduction is the first thing, but if the thrombus keeps on growing, it can completely occlude the vessel, leading to death. Now, would it be a sudden cardiac death? Why is it not like the conventional heart attack in which the person gets time to go to the hospital, gets treated? We'll talk about that in a minute, but then try to understand that a complete thrombotic occlusion is going to not cause damage, not cause injury. It causes infarction. Infarction means death of the tissue. Now, if this phenomena is occurring in all the coronary arteries, it could lead to a failure of the pumping of the heart, and the person can go into sudden cardiac death. Now you can see a mouse moving over a blood vessel, electron scanning microscope, which shows the SARS-CoV-2 or the spike protein or the SARS-CoV-2 with its spike protein attacking the endothelium, inviting the pathway of abnormal clot formation, which we call it as a thrombus. So when I was a med student, they taught me 2 or 3 basic things. What causes the formation of a thrombus? So the stars are visible here. They say that endothelial injury, number 1, stasis, hypercoagulation, and vasoconstrictions are the leading causes of thrombus formation. So the question, is there an endothelial injury? You just saw. Is there a hypercoagulability? Now we'll explain this to you, to make things go a bit simple. When the SARS-CoV-2 produces spike protein and it's attacked by antibodies that you see here, they actually are present in the blood. They turn the blood more coagulable, which predisposes towards formation of clots. You also see ACE2 receptor going down. We'll talk about this in detail, but then ACE2 receptor, if goes down in a spike protein mediated injury, which engages this receptor, ACE2 cannot inactivate many hypertensive molecules, including angiotensin II, which leads to hypertension. Hypertension, we have heard about it, but the thing is, when the blood is actually getting into vessels with a great pressure, it actually itself can be damaging to the endothelium. So all these factors shake hand, and then the thrombus formation takes place. This slide again shows you the effects of it. Once an athlete or a professional or person, which was previously very fit, gets a thrombus in a vessel, you heard me, the effects are there in form of a cardiac ischemia or heart attack. It could be a stroke. So this slide shows you the effects of the formation of a thrombus. And if you can clearly see in the center, there are Y-shaped structure, yellow in colors. These are the anti-SARS-CoV-2 spike protein antibodies, which themselves can sit over the endothelium and initiate the injury. So be it a SARS-CoV-2 infection or the spike protein of it set loose, both of the conditions can lead to this Y-shaped antibody getting engaged with that spike protein, damaging the endothelium, doing the thrombus formation and leading to heart attacks and strokes. Now, there is a question. I mean, like, is it the entire SARS-CoV-2 virus, or it's one component of it? What's actually causing these healthy athletes to die on ground? I mean, like a conventional person who has a heart attack, who's taken to a hospital, gets treatment, comes back, survives, gets over a period of 20 years, maybe congestive cardiac failure, not happening. I mean, like, this is, you know better than me the meaning of sudden. Sudden mean at the spot. So what's causing this in these young athletes? Now, let's show you some stats here. The facts and the figures would speak for themselves. You can see the marked star. Can you see a very sharp rise in 2021? So this is data coming from the web link, okay, posted below. You can check it for yourself, see the incidence before 2019 and see the incidences now. 2021 alone actually outclasses all the other years, okay, in showing the incidence of these heart attack in young athletes. Okay, next one. See how much the cardiovascular incidences actually dominated the scenario in 2021 alone. Now, these are trained athletes, okay, which actually died on the spot in a training or a match performance. Okay, see the spike, and don't forget to see the year just on the x-axis. You can see the 2021 mark right there. Okay, let's go to another stat figure. Okay, so let's show you next slide. See, this is FIFA profiles, okay, which are showing you how many deaths did occur in 2021 alone, and you can see again the blue star being marked over both. I mean, the male training deaths that you can see in the black, what you call as a bar, and cardiovascular male deaths, okay, during training are both visible here. So these are all stats, okay, which are not homemade. You can check them, that these are virtual figures, okay, derived from data collected from various resources. See, this is predicted FIFA professional football soccer player deaths in 2022, okay, per quarter based on 2021 trends. Okay, so what we are expecting in 2022. See the quarter one and see the quarter four. I mean, look at it's exceeding the mark of 320, 340. Okay, so this is the prediction that we should be very open about that based on the trends of 2021. This is what is about to come. Alarming. I mean, like, if alarming would be the last word for its expression. So now the question. I mean, like, the media is filled with it. I mean, like, and they want to uncover the mechanism behind it. That what's actually causing this type of death in athletes, and why athletes? I mean, like, why it's not being reported in other professionals who are not that trained in their daily routines and exercise and performance of athletic what you call as exercises. Will tell you that this hospitalization is lucky. I'll tell you, because she managed to reach a hospital. The cases that we are discussing, they don't reach hospitals, please. They die on the spot, as you saw in the previous slides, okay, like the colleague players, okay, calling for an ambulance, and they fail to make it to the hospital even. So the COVID-19 related, or the SARS-CoV-2 related, or the spike protein related coagulopathies are there, and we are about to experience an alarming rise in the cardiovascular deaths in professionals like trained athletes. Brings you to this question. This is my favorite slide. Okay, I'll tell you why. And here we are about to discuss some ongoing mechanisms, okay, which you possibly don't see in a conventional what you call as a publication or a paper. Now notice this. Okay, the athlete is trained, the more he will have a fluctuating blood pressure. Now, why I say this is because you can guess it, okay, that when he's performing extraneous exercises or he's actually testing his body to its full, just imagine what would happen to the blood pressure at that time. Obviously, it would shoot and the blood pressure values would be high. Question, what is the protective mechanism of the body to combat this blood pressure and bring back this athlete when he gets a shower and he's resting? The ACE2 receptor. And you should not be surprised that this ACE2 receptor is the one which actually is a prime target of SARS-CoV-2. I'm not going into details of other mechanisms by which the SARS-CoV-2 can enter inside the cell, but this receptor is very well documented. So resting levels of ACE2 receptors in a trained athlete is out of proportionally high, okay, because it wants to regulate his or her blood pressure back towards normal. And you know what happens if the ACE2 receptor is like overexpressed in endothelium or your body tissues. If this athlete by chance gets a viral infection, or he has got a shedded spike protein in his blood, it would go directly damage the endothelium. You can see it here where the mouse is moving, and all that thing that you saw in the earlier slide. Neutrophil elastase is breaking down the SARS-CoV-2 protein into S protein into fibrils. Those fibrils further magnifying the formation of the clot. So those clots go and they completely occlude this vessel. And I mean, like, we have got 3 main coronaries. Just imagine that if that phenomena is happening in all those coronaries, there would be an immediate pump failure. And that pump failure then leads to, you see the last slide on which I'm moving the mouse now. I mean, he would be very lucky, I would say, that if he or she manages to reach the hospital. So I don't know how many papers have highlighted this, that the basal, and we can research it at any time, that what's the basal expression of ACE2 receptor in a trained athlete. My guess is that since they are training that hard and their blood pressure rises to very good levels, okay, during exercise, the body mechanism to combat it is via the formation of ACE2 receptor, which attempts to lower the blood pressure. Now, the athlete would be very lucky, okay, if he or she doesn't get that SARS-CoV-2 exposure, because if he or she does, or there is a shedded spike protein in the blood which attacks the ACE2 receptor, forget about that blood pressure coming back toward norm, because now you have actually umbrellaed that receptor or hijacked it, okay, by that SARS-CoV-2 protein, and ACE2 cannot do its job. So what would happen to the blood pressure? Blood pressure would remain high. And if you remember, and just pardon me for going back to that slide because it's so very important, you remember a endothelial injury in combination with hypertension with stasis, what it does. All of them favor the formation of the blood clot. Now, don't think that I'm forgetting something to mention about the myocarditis part. Myocarditis is actually the inflammation of cardiac muscle cells that can happen if that spike protein, studded SARS-CoV-2 attacks the heart muscle cells. That's another story. I'll tell you why, because myocarditis does not cause a sudden cardiac death. The topic of which I'm exploring today, and then I want to actually go into detail of what was the sudden cardiac death. And sudden cardiac death can happen only if there's an acute pump failure. And even if you cut the nerves to the heart, okay, the heart has got mechanisms by which it could generate its own beat. So it's not the rate. It's not the inflammation of the heart muscle cells. It's truly occlusion. And when I say occlusion, I mean complete obstruction of the blood flow to the heart, healthy muscle cells, which then go into, I'll tell you 3 words that I learned in my medical school: ischemia, reduction in the blood flow; injury, that reduction in the blood flow then injures them; and then infarction. Infarction means death. And if you occlude a coronary, which you see here, with a occlusive thrombus, a thrombus which does not allow even 5% of the blood to go forward, it would cause acute pump failure. And the person just drops dead, okay, like a cut tree, you know. So that's what we are observing. So if somebody thinking that myocarditis could do that, okay, can have a debate with me on that. I don't think myocarditis is behind it. So that uncovers actually of the occupancy of a receptor which was meant to lower your blood pressure by that spike protein, which if no more there, is going to cause that complication. Just to give me 5 seconds, please, to go back to that slide where I showed you a combination of factors acting. No, this one. This is my second favorite. Okay, why? Because it actually tells you the entire story of thrombosis. So the question number 1, is there an endothelial injury in athletes? Yes, there is. What's causing it? Spike protein, okay. Then what type of thrombus does it form? It's not partially occlusive. It's totally occlusive. What would it do? Pump failure. Is there a hypertension in these patients? And you know now what I meant when I showed arrow in a downward direction on ACE2. Why the ACE2 is low? Because it's occupied by that spike protein. The spike protein and antibodies together formed in the blood will create hypercoagulability. More the blood is coagulable, the more it will cause the development of a thrombus. So all these factors will come into play in an athlete, okay, who has got a normal blood pressure regulating mechanism, which is so much dependent upon that ACE2 receptor, and the person can fall dead on the ground because of the reason that there is an acute pump failure. So this slide actually is a bit complicated, not my favorite though, but it's operating in the body of that athlete. Just see on the left hand side, it says ACE2 receptor no more functional, would lead to all of these, which would lead to hypertension. SARS-CoV-2 spike protein can be seen in the blood here. and it's with that Y-shaped structure, antibody is damaging the endothelium, you bet on it, okay, the thrombus would be there. Question, would the thrombus stop developing? No, in this case not. Why? Because there's not a single player. Endothelial injury shakes hands with hypertension, shakes hands with hypercoagulability. So if you have got 3 or more predisposing factors, the thrombus would keep on growing, complete occlusion, heart attack. So just please pardon me if I'm not using the word microclots or clots here, because you heard me earlier that clots are normal. Either you call it an abnormal clot or you call it a thrombus. So this slide shows you how all those mechanisms do shake hand in order to produce that thrombus, which actually then causes the sudden cardiac death. Now, this is last slide, okay, where this is one of our publication, which is under review in a journal. I managed to actually compare that spike protein with human amyloid protein, okay, and found some sequences in that spike protein which are like that amyloid, the fiber that you heard me saying again and again as fibrils. So the thing is, it has been proven that the spike protein can be attacked by neutrophil elastase, which can break it into these very undissolvable moving fibrils. And the question is that, does the spike protein has those sequences? Here you can see that the red arrow is showing human amyloid precursor protein. S1 protein is marked by green, and you can see the bars and the dots where the sequences matches. You can ask a question. If I would be a reviewer, I would ask that question. This is not a perfect match. I mean, like, the bars are perfect match. The dots are like similar amino acid. So what makes me think that this S protein sequence is just like that amyloid? See, this is the point, and that's an eye opener. These clots are formed in the body of those athletes, but cannot be digested. They cannot be lysed. Why? Because they are just similar. They are not identical to the conventional clot or the conventional thrombus. Because if they were like conventional thrombus, our body has got fibrinolytic mechanism to dissolve it. But if it is different, as shown here, the fibrils are not going to dissolve. And then that fibrinolytic therapy, the kinases that you give to that patient, if he or she is lucky to reach the hospital, because you don't have those streptokinases on the field. I mean, the conventional health manager and the doctors don't carry streptokinase, urokinase, and plasmins and fibrinolytic agents in the football ground. So even if they had it, okay, and you give those injections to these guys, okay, who are going into sudden cardiac death, it won't dissolve the thrombus for a reason that the green arrow and the red arrow are different. So the S protein alone is capable of forming fibrils, okay, which are undigestible. They're the part of the clot, and they're the part of that sudden cardiac death that happens. Thank you very much for listening to this. Guys, you have got any comment, any questions from this, please feel free. This organization has got my email address, okay, they can refer you back to me if you have got questions, okay. It was a pleasure coming and giving a talk here. Thank you very much.